Learning to conduct an efficient new patient examination and consultation will have a profound effect on patient treatment acceptance of comprehensive dentistry. Microsoft Office is an open source software that is very effective at gathering and organizing data. It is not proprietary to dentistry, so it does not lock you into any standard format that limits your ability to expand on data. Using templates, you will conduct each exam for each patient the same way every time, so consistency and efficiency is emphasized. There is a learning curve, and you may need some custom training, which we can arrange in a 2-day format of hands-on learning to get you up to speed. These courses are limited to 10 or so participants, so that each participant receives individual instruction. So don't be intimidated by the extreme power and flexibility of the software. The benefits of the process will pay big returns in a very short time. In this video, we're going to discuss the use of Excel, which is a product of Microsoft Office, one of the components of Microsoft Office, to facilitate treatment planning and data collection. Excel, of course, is a spreadsheet that has unlimited capabilities, the flexibility to write as much as you need so that your narrative is complete when you're ready to sit down and do your treatment planning. And I find it's a wonderful way to collect data, keep it organized, and then assemble your treatment plan. Excel is great at storing data. It's also great at adding numbers, so it can add up treatment plans. You can develop a very logical flow that will allow you to organize your treatment thoughts in a very logical manner. Excel has a series of tabs. What you're looking at now is what we call the medical history or the medical screening tab. And you can answer these questions. You can fill out supplemental information in the column to the right of each question. You can expand the rows so that the information can grow as large as it needs to. You can add rows. You can, if you have more room, if you need more room, you can add rows in so that you have all the information that you need. So this is the beauty of Excel. It's a very readily available program. It's not proprietary in that it doesn't lock you into a certain methodology for categorizing the data or entering the data. And so therefore, pretty much have free reign to write or enter as much as you need. So this is the beauty of working in Excel. It's like any other software program. You have to learn how to manipulate the software, how to add rows, expand rows, column widths, various functionality. But it's really good at managing data and keeping your thoughts organized. On this particular medical screening tab in the periphery, I've added several tables that talk about other medical conditions, bronchi, diabetes, hypertension, just for reference to give you an idea of when a particular condition is more or less problematic. So you go through answering the questions, filling in the information, so that you have a very, very thorough medical history. And this is a supplement to the medical history that the patient fills out and signs. These questions have just been generated from several years of practical experience, several courses that I've done over the years, and the specific questions that you want to verbally go over with each patient to make sure that you have a handle on what they're doing, what their medical history is like. Now in our office, the assistant primarily goes over these questions in their preliminary screening, and then they leave it up on this computer screen so that I can review it with them when I start my exam. This is all part of the new patient exam visit where we're collecting the data. Once a patient is consented to the comprehensive exam, we begin by opening one of these spreadsheets that has these multiple tabs on it, as you'll see in a minute. And we start with this medical history tab, where we go through these questions, and it has a little bit of redundancy, but by the same token, that redundancy allows us to flesh out the patient's medical history much better than what you would get by reading a form that they fill out that has checks for yes and no that the patient might enter. Once we get that completely filled out, we can come over to what I call the NPEC Form, New Patient Exam and Consultation tab. And up in the top section, you can summarize the medical history. You can list the primary conditions that the patient has. You can list medications that they're on, and you can list their allergies. You're kind of just taking the information from the medical screening tab and entering it here in a very condensed summary form. Now, I would not waste time doing this while the patient is present. This is something you can do after the fact, after the patient's been dismissed and you're organizing your thoughts. You can summarize the medical history information in the top of this new patient exam form, which is the primary form that you're going to be working from to develop your treatment plan. You can switch back between the two tabs to gather your thoughts and bring the information forward for summary on the new patient exam form. Once you do that, we're going to look at the chief concerns as per patient section, which is just below this. This section is organized with a left column for the area, the particular area that is in question, and a section for the description. Once again, this description can grow big. Over here, I put anything that the patient might say that would affect his or her ability to proceed with treatment, as well as their actual chief concerns. What's bothering them? What do they want to have done? Are they wanting aesthetic treatment? Are they more concerned with function? They have financial issues that are going to prevent them from moving forward. Kids in college, just bought a new house. Anything that they might say, we list in this section so that when we're doing our treatment planning, we will have access to information that might affect their ability to move forward with treatment, and that would express what their true wishes and needs are. This section is filled out during the assistant's interview with the patient as they bring the patient in and they start talking with the patients. Whatever is said in that particular conversation gets entered here. Anything that might be pertinent, of course, to the patient proceeding with treatment. And then as you're going through the exam, the dentist might dictate other information to be added here as it is brought forth during the conversation. This is the patient's wants, needs, and desires. The next section down is what we call the 1 to 32. It is essentially a tooth-by-tooth examination where you make a comment about every tooth. Is the tooth missing? Or is it stable? In other words, if it's stable, it really, you don't see anything that you feel like you really need to do for that tooth. Does the tooth have a very large filling that needs to have a crown done? What are you seeing on the x-rays relative to this tooth? So the left column is for a description. The middle column is things that you think need to be done to this tooth, proposed treatment column. And the far right column is radiographic findings, what you see on the x-rays that may impact what's going on with this tooth and what needs to be done. When the information is longer than one row wide, the row can be expanded so that the information fits. As we're going to do right here, the information doesn't quite fit in that row, so I'm just going to make that row a little wider so that the information appears properly. So we're going to go around the patient's mouth, tooth by tooth, 1 to 32, and make a comment about every tooth. Now, of course, the way that we do this is as I'm conducting my exam, I'm dictating what's in the patient's mouth, what conditions are present, and my assistant is typing this in to the Excel spreadsheet. This spreadsheet is sitting straight over the patient's head on a secondary monitor so that I can see what the assistant is typing and the patient can see what the assistant is typing. And as we're typing this in, I make any corrections to the information and the way it's entered so that my thoughts get captured into the form. Because ultimately I'm going to sit down with this form a week or so later after the patient's gone, in conjunction with their photographs and their models, whatever we decided we needed for that particular patient, and sit down and do a treatment plan. And this is the information that I need in order to properly sequence a plan. So we just keep working our way through. We can use various tools like copy and paste, fill, etc. to make the information display properly and also to facilitate a more speedy data entry. If two teeth both have the same status and needs, you can copy that information to the next line and make it very, very quick to go through this information. If a whole series of teeth are considered stable, you can just fill that information down through the form. There is a small learning curve to being able to manipulate the software and move through the fields and enter the data, but the benefits of working in Excel make the effort to learn the software very worthwhile. I've taught numerous assistants how to manipulate the software, and generally speaking, they catch on really quickly. So don't be intimidated by the look on the front side, because the benefits of learning this process will be well worth it and pay back huge dividends very quickly. At the bottom of the form, I've added a section that's just sort of open-ended. I can make notes here, such as patient might need a occlusal guard or a night guard after treatment is completed, things of that sort. Later, this information will be used to facilitate putting together a treatment plan that makes sure we don't forget anything or leave out pertinent information. This next section is the mobility section and the perio screening. You can make notes here about plaque calculus and stain, what type of a perio cleanup and or maintenance plan you want to have for the patient. And you can note about the mobility of individual teeth in the mobility section. When we get down to the questions about clinching and grinding, they actually were on the medical screening tab, so we can go over there, pull that information, and paste it here accordingly. So we have questions about them grinding their teeth, difficulty chewing, things of that sort that were actually found back on the medical screening tab. So we switch over there, grab those answers, and pull them forward. If you see you missed something on the medical screening tab, you can add it back in as you switch back and forth. We call this section our summary of occlusal status or status of occlusion. Little section about the TMJ and the screening. Little section down here about signs and symptoms that they might be having of TMJ dysfunction, as well as how does their occlusion function? Is centric relation equal to centric occlusion? How does their anterior guidance work? Do they disclude posterior teeth? Things of that sort are down in this lower section. And so we just go through these one at a time. I'm evaluating the patient, and I'm dictating what the assistant is typing in. Of course, this form is a template, so it has lots of basic information already in it. Maybe you might say some of the more common answers to these questions. And so if the information is accurate and you don't need to change it, you can skip on and move on down through the form. But you want to update it and make it accurate and relative to the patient at hand. So here we're discussing what the anterior guidance is doing. Is it discluding the posterior teeth is usually my number one objective here. This patient discludes posterior teeth in all directions, and so therefore I'm able to just copy this through intrusive guidance, right and left lateral guidance. We make a little statement about their overbite and overjet, and about the wear, if there is any present, on individual teeth as well. Working from a template like this allows you to just not miss information. It makes sure that all the information is charted the same way on all patients. We want to now switch over to the practice management chart, and I like to get a very thorough documentation of all the restorations in the patient's mouth as they present. The restorations that they present with to the office will chart in green. Anything that is a problem or a condition will chart in red. And the treatment plan items will also chart in red, the things that need attention. And then the treatment that you actually give will chart in blue. So after you've treated a patient for a long time, you'll have red, green, and blue items that really give you a good picture of what's going on, what you've done, what was done before they came to you, and what they need to have done. Now, once we've done that, we want to go through and chart the things that they need to have done. You can do some of this while the patient's here, but most of it is done after the fact as you get involved with treatment planning. Once you've completed data collection and dismissed the patient, it's a good idea to sit down right then and kind of go over the forms and make sure that the data is well organized and has your thoughts in your words so that you'll have this information for treatment planning later. You can list medications here in this column, as well as what the patient is taking them for. And now at this point, we've completed the data collection. Now we're just kind of cleaning the form up. I can take away excess lines that are really not needed so that we don't have a lot of extraneous blank space. Once the data collection is complete, the patient is dismissed, at some point I'm going to sit down and do a treatment plan. The treatment planning process generally requires me to have free time outside of office hours. I need to have time to think this case through in a logical sequence. And we're going to develop a treatment estimate. We're going to then put that into a treatment schedule that contains a timeline as well as a payment schedule that can be presented to the patient in a very concise, efficient manner that they can understand. First, we create a treatment estimate. We're going to look at the data, assemble our thoughts, and primarily take the information from the 1 to 32, which has the things we think we need from each individual tooth, and put it into a template that has various procedures that are very, very common. Of course, we can add procedures that might not be on this list, or we can modify as need be. It even has the basic fee for one item. If we're going to put in multiple items, we would change the quantity number in the green column to reflect how many of that particular item that we need. We can enter the teeth numbers in the area column so that we know which teeth we're referring to. And this will begin to create a total treatment plan fee that we will eventually balance to the practice management software. So we're going to start with a template, and then we're going to customize it so that it only has the things that this patient needs at this particular time. This is the treatment estimate. It literally is just a widget counter, if you will. In other words, how many of each item do we need? We need an implant here. Which tooth number is it? It's tooth number 8. It'll be one implant. And so on and so forth. This is where we can change the fees. We're going to put surgical extraction in. You can, if the fee needs to change, then it can be done. I can eliminate the stuff that is not pertinent to this particular patient. This patient is not getting any complex periodontal treatment as far as cleanup is concerned, so I'm taking that information out. Not getting ortho, so I'm taking that information out. Bleaching, etc. Taking out anything that's not pertinent and leaving in the things that are. We do need a CT scan. We're going to be doing an implant. So we definitely plan for that. Once we have the information entered into the treatment schedule, the treatment estimate, we can go into the practice management software and enter all the treatment into the practice management software. The beauty of this, as you'll see as we get into the logical sequencing, is Excel makes you think logically. What comes first, second, third, right on down the line. The practice management software allows you to think graphically. You see it on the page, and so you can visualize the treatment. This is important because sometimes you'll see things graphically that you won't think about logically, and then other times you will pick up on things logically that you might have missed when you were in the graphical environment. So thinking the case through in two different manners helps to make sure you don't leave things out, and when that happens, it either compromises the treatment for the patient or it puts the dentist in a difficult situation of trying to go back and explain and add things to a treatment plan that's already in progress. You'll sometimes refer back and forth to your 1 to 32, back to your treatment estimate tab in putting this plan and this information together. Our ultimate goal is to make sure the fees balance between the practice management software and the Excel software. That's why I like to work with the two screens overlaid so that I can see the information on both sides as I'm entering it. Once we get that saved, the fee in the practice management software should equal the fee in the Excel spreadsheet. Once they do, and you've transferred everything from the 1 to 32, and all of your notes have been covered from the new patient exam, you know you've got a comprehensive plan that covers everything. Now we're going to copy the treatment estimate information over to the treatment schedule. There's a specific way you do that so that it falls directly into the form. These forms have timing set up to make sure that that happens. But you ultimately, when you copy it over, your fee for the total of treatment items in the green column should match the original practice management software. This is a floating date in the upper left-hand corner of this form. We're going to start by setting that date so that it locks this date in, and then that becomes the anchor point for the rest of the timeline, as you'll see as we begin to develop that. Essentially what we're going to do is we're going to now take these items that this patient needs, and we're going to put them in chronological order that works best for this particular patient. So we can insert some rows, we can build space, and then move lines around so that ultimately the plan flows in chronological order according to the needs of this particular patient. So I can move this information up because I want it to happen in this particular position in time. I can remove excess lines that have been created. You can see here my data doesn't fit into the slot, so I can expand that row so that it does appear. And then ultimately what we're doing is developing a paper that we can use to show the patient. It'll have a timeline in the left-hand column that gives the approximate amount of time it's going to take to complete this treatment plan. Is it going to take a month? Is it going to take a year? 6 months? The patient will be able to see it very clearly. And in the right-hand column of what's printed is the payment schedule. And the payment schedule will correlate to the timeline so that a patient can see that if a treatment plan is very large, they will see exactly how long they have to cover those expenses. As you're developing the logic, if you see you've missed something, you can add it in. Then you have to go back and add it to the practice management software as well. You want to keep these two in balance. The real beauty of Excel is that it maintains the logic. It's got a lot of words that explain when you're doing things and why you're doing things. The logic can be presented to the patient. The difficult part about practice management software is it doesn't maintain the logic. It's just a lot of lines that really don't have any logical meaning to them, especially to a layperson. Another disadvantage of the practice management treatment planning is not everything charts in a graphical environment. Things like bone grafting don't chart. Occlusal splints don't chart. So by working in both environments, you make sure that your treatment plan is very, very thorough. And once you have added the new things in, you're constantly making sure that these two numbers match. Now we're going to develop the timeline. I'm going to use formulas to develop the timeline. We're starting with this anchor point. Generally speaking, it's the day of the consultation. And then these formulas essentially is counting days. I can in a particular field, if I type equals the previous date plus X number of days, how many days it is. If you're going to place an implant and then 3 months later you want to do a CT scan, you can type equals the date of the implant placement plus 3 times 30, and that will calculate the date of the CT scan. Now, I always tell patients that these dates are very, very relative. It's just to give them an idea of how long it's going to take to progress through a plan. It doesn't mean that we're locked in to these particular dates. It's just a relative timeline. But the patient needs something to give them an idea of how long this is going to take. It's very helpful to have this information so the patient doesn't think that this is all going to happen in a matter of 1 week or 2 weeks or whatever the case may be. So we just continue developing the timeline until we get to the very bottom, and we'll essentially have a breakdown of times for when the patient can expect it, generally speaking, when they can expect to get through these procedures. We're going to now throw in some box lines for aesthetic presentation, and as we get to looking at the printing of this form, you'll see the beauty of this. Just sort of groups the items into sections that create a very nice organizational flow to the presentation. You'll see in a minute that only the section to the left is what prints and is what you end up showing the patient. And it'll have the timeline, it'll have the description, and it'll have the payment schedule. The actual detail on the far in the green section will not be printed. That's the area where the Excel spreadsheet is adding up all of the items and making it match with the practice management software. But all we really care to show the patient is their payment schedule. How are you expecting them to pay for this? And we'll talk about that. You can see right now down in the lower that this thing is printing on 4 pages and part of our information has been chopped off. So we're going to work with the formatting so that we get this thing to print on 1 page if possible. And most of the time I can get these, even a complex plan, I can get it to print on 1 page. If you could print it on 1 page, it just makes your presentation a lot more simple, and it makes it more easy for the patient to understand. So we're just changing the column widths, and we can change the way the information is displayed, display it a little wider so it doesn't take up as many lines. So we can adjust the horizontal width of the form, and we can adjust the vertical height of the form. The ultimate goal is to get it to print on 1 page. And we want it to print all the way down to the patient's signature line. And so we'll continue working with this, making vertical and horizontal adjustments until I get it printed on 1 page. Now we're going to begin formatting the payment schedule. We want to just be sure to add up all the numbers at the right-hand green column so that the total of the payment schedule equals the total of the overall treatment plan in the far right green column, as well as the amount of the treatment plan back in the practice management software. I want to format this payment schedule in a way that spreads the payments out over time, but also keeps the patient sort of paid ahead, if you will. And here again, this is also using formulas to add these numbers up. Now we're adding up the total column, we're adjusting the formula in the total. Now we want to make sure that this total equals what we have in the practice management software. So the total of payments equals the total of plan. A small 5% discount will make a big impact on a comprehensive plan. This would be for cash and check only, so you don't have fees for financing and credit cards and things of that sort. So now we're going to make final adjustments. We're going to set the print area and make final vertical and horizontal adjustments so that it prints on one page. You can see now we've got it printing on 2 pages instead of 4. The width is correct, but the length is not quite correct. So we're going to take out some lines, make vertical adjustments to get it to print on one page. Okay, now it prints on one page. The signature line is present, and we've got the full width. All the information is included. The patient's payment schedule is here. The timeline is on the far left. And of course the descriptions and the areas are all delineated. And that pretty much does it. You're now ready to go to presentation and have this patient consent and sign up for treatment. Hey, thank you for watching. I hope this has been beneficial. If you have questions or comments, you can email me at drp@drpatedmd.com. I love to teach courses at my office from time to time. These are boutique type courses limited to 10 to 12 participants at most. My passions are guided surgery, data collection, and case presentation for the new patient exam. We utilize Excel to organize and streamline the data collection, and then PowerPoint to illustrate the treatment, customizing the presentation using the patient photos obtained during data collection. I also love to discuss digital diagnosis using Exicad. Wow, that's a big topic, but so much fun. If you're interested in any of these topics, I'd love to hear from you, and we can set up some time to get you up to speed on your topic of interest. Now, these courses are software intense. I find the biggest roadblock most dentists have to digital dentistry and guided surgery is learning to use the software. So we dive deeply into the software so that you learn the fine points of the digital world. We can initially outsource the 3D printing, and once you know the software, in-office 3D printing is easy to add. We can plan one-day classes, but the most benefit is obtained from at least a 2-day format with any of these topics to become proficient. Have a great day, and I hope to hear from you soon.